Welcome to the Purveyor Orthopedic presentation, all about the common hand, wrist, and elbow disorders, including treatment options. It's my pleasure to introduce Dr. Dan Metz as your presenter. Dr. Metz.
Good evening, everybody. It's a cold, wintry night here in Green Bay, Wisconsin, and so hopefully you guys are warm in your own house or office. So I'm an orthopedic surgeon, and we're going to be talking about multiple disorders of the hand, wrist, and elbow. And as Chris had mentioned before, if you have questions, you can just, I believe you could list your question. We'll try to answer at the end of the presentation. So let's go to Purveyor in general. So Purveyor is a large organization, and I started here 11 years ago, and we were just on the eastern side of Wisconsin. Now you can see on the map on the left, we've expanded north and south, and now we've expanded to western Wisconsin as well. So different topics we're going to try to hit. Ganglion cysts, what are they? Where do you get them? How do we treat them? Probably the most common reason for hand numbness is carpal tunnel syndrome. The very big topic is hand tendonitis, and also talk a little bit about elbow tendonitis, specifically golfers and tennis elbow. Arthritis, and arthritis comes in lots of different ways. We have rheumatoid arthritis, we have wear and tear arthritis, which is called osteoarthritis, and also post-traumatic arthritis. Probably the most common thing that we actually see and treat is arthritis of the thumb. Trigger fingers, and if you're a diabetic, you probably know what I'm talking about. Trigger fingers are very common in diabetics. And lastly, something that's a passion of mine since I've had it myself is called cubital tunnel syndrome. So it's the opposite of carpal tunnel. Instead of in your thumb, index, and middle finger, it's usually your fourth and fifth finger going numb. So let's start with ganglion cysts. And so ganglion cysts are not a tumor. So a lot of people come in and they're just worried that maybe they have a tumor somewhere. And maybe they've had breast cancer or lung cancer, and they're worried that maybe they have cancer somewhere. So ganglion cyst is a fluid collection. The most common area that we're going to get it is over a joint. And when it comes to the hand, wrist, and elbow, if you looked at this person's hand on the keyboard, I'm going to use my mouse and circle. The round little bump right here is the most common thing that we see for lumps and bumps in the hand. That is a ganglion cyst of the wrist. So that is something that I can just look at, and after many years of experience saying, we don't need to spend a lot of money and working this up, meaning that you can do ultrasounds, you can do MRIs. Usually we start with x-rays to see if that cyst is related to a arthritis or a bone process. But for the most part, that's a ganglion cyst. Not all ganglion cysts hurt. I remember years ago having a guy with a huge cyst over the back of his hand. It was gigantic. And I asked him, so obviously that must hurt you a lot. And he goes, nope, it doesn't hurt me at all. I'm like, so why are you here? And he goes, my wife doesn't like the way it looks. So when it comes to cysts of the hand, go to the next slide here. So the most common area, and if you look at the wrist on the right side here that I'm going to circle, you can actually just see it closely here. This is pretty classic for a ganglion cyst. There's actually two little lumps here. So this is called a bilobed ganglion cyst. So the most common spots for these cysts are, number one, are just like this woman's hand is on the back of the wrist. So right in this here general location. Now, some people have a little bump about right here. And that little bump, if you feel it really hard, if it's hard, it's probably a bone spur called a metacarpal bossy. The second most common spot, if you turn your hand this way and you put your finger right here, there's an artery. So when the doctor's office, when they check your pulse, they usually check an artery right there. But that's the most common area, second most common area for a cyst on the wrist. The third one is usually located like right in this here area. So right in that area, the small cyst is actually coming off of a tendon rather than a true joint. And what makes those hurt is if you try to grab or squeeze something, especially like a shovel or a broom handle, that's where that bothers people. And the last area of cyst, and we'll talk about this maybe a little bit later with arthritis, right at the tips of the fingers right in here, people can see, I'll get a little closer at the fingernail, a little lump or bump in this area. That lump or bump is probably either a bone spur or a small ganglion cyst. And the ganglion cyst, because you think about you're trying to move the tip of the finger, that produces fluid. That little fluid shoots out, and it's usually right on between the last skin fold and the nail. So if you have a ganglion cyst, what do you need to do? If it's a ganglion cyst, it's not a tumor. You're not going to die from it. Some people want to get further treatment because they're concerned about being a tumor somewhere, and they may have had cancer, and it's very scary. So usually the test that we can do is an ultrasound, or more commonly an MRI. What's nice about both those tests is there's no needles, it doesn't hurt at all. Obviously, there's a cost involved with it. So if we can reassure somebody that you got a lump or bump and it doesn't hurt, we can just observe what's going on. So observing what's going on here is mean if it gets bigger, come back and see us. Now, the old way of treating ganglion cysts, especially on the back of the wrist here, is called the Bible treatment. So imagine if you had a lump on the back of your wrist and you took a Bible and you hit it really, really hard. You could potentially pop it. Most people don't like to do that. But I've actually had cysts on my own wrist, and I did almost identical to it. I was able to pop it. It went away. Problem solved. The third way to treat this is numbing up the skin and then trying to use a very large needle to suck the juice out. Now, when you think of it being fluid filled, you think of it being more like watery. So it should really suck out really easily. But it turns out that the fluid is actually very thick. It's very viscous. So if you imagine going to McDonald's and getting a milkshake, as soon as you put your straw in the milkshake, you have a hard time sucking that out because it's too thick. Sometimes you got to wait for it to melt just for it to get more liquidy. So sucking this out is usually successful, but maybe only about 30 or 40% of the time does it stay away. So the cyst, we can suck it out of there and it may or may not come back about 60 to 70% of the time. Another way of doing that is suck the cyst out and then stick a cortisone shot in there. The downside to a cortisone shot is, especially if you look at the back of your wrist, there's not a lot of skin back there. So if it leaks out, you can get a white spot in the back of your skin. And women especially don't like to have scars on their hands or big things that they see. Guys obviously have a little bit more hair on the back of their hand. Get a little closer here. So it's tough to see scars. In fact, if you look closely here, I have a scar from surgery right here, and it's hard to see because I have a lot of hair on the back of my hand. Now, removing them is an option, and depending on where they're at will dictate the surgery. I would say most people are back to work doing most things in 2 to 3 weeks, but there's a chance that the cyst or lump does come back. Now let's move on to the most common reason for numbness of the hand. The most common reason is carpal tunnel syndrome. Carpal tunnel syndrome is a nerve that's pinched. And when you think about it, all the nerves start in your brain and come down the shoulder. They go underneath your collarbones. Then they start dividing out. One specifically goes to the thumb, the index finger, the middle finger, and ideally it would be only about half of the ring finger. That nerve goes underneath the middle of the wrist. That nerve itself is called the median nerve. And so the most common thing that we see is people waking up with numbness and tingling. The numbness and tingling involves usually the thumb and like these two fingers and sometimes this. If somebody comes and sees me and says, my little finger is also going numb, that's probably a different nerve. Either the nerve pinched up in the neck or it's a nerve pinched at the elbow called your funny bone. Typically, the pain of someone who rolls into my office and says, I think I have carpal tunnel, means that they've had problems over the last year or two. It doesn't happen just usually overnight. It involves numbness and tingling. And when it gets really bad, people wake up in the middle of the night and they shake their wrists and they get out of bed even. They can't sleep. So that's why sometimes when we sleep at nighttime, we think about we sleep with our hand turned over. Sometimes we wear Velcro wrist braces at nighttime to keep your wrist from flopping down. That's put pressure on that nerve. If you're pregnant, usually during pregnancy, women very commonly get carpal tunnel. And they get carpal tunnel because as the baby's growing, women are putting fluid, they're putting weight on. That fluid then tends to swell up the nerve at the wrist. If you look closely at the picture on the right-hand side here, the cross-section shows the person's thumb right in here, and the nerve that goes to the thumb, index finger, middle finger, and part of that ring finger. And the reason why it gets trapped here is God made us pretty good, but he put a ligament in the wrist, and the ligament in the wrist here holds all 9 tendons, all 9 tendons that let you bend your hand. So there's 9 tendons that let you do that along with the one nerve. So if you get a lot of inflammation around those tendons, it can put inflammation around that nerve as well. So this is the tunnel we're talking about right there. This picture doesn't show it, but there's actually 9 tendons, not just 6 in there, plus the nerve. So it's a crowded little tunnel. So how do we diagnose this? If somebody walks into my office and says, hey, I've had numbness and tingling, I maybe had a baby 3 years ago, had a second baby last year, and I started getting numbness and tingling in these couple of fingers, it wakes me up at nighttime. I've used a cock-up wrist brace for 6 months. It helps at least, but I forgot to wear my wrist brace last weekend, and now these fingers are numb. That is classic for carpal tunnel. So just listening to the patient a lot of times will tell us if what is going on. Sometimes we examine people, we check their strength, so their grip strength, try to check if their fingers are nice and strong here. And then we start tapping on the wrist. That nerve right there, if you tap on the nerve, it's irritable, it will sometimes shoot numbness and tingling to the tips of the fingers. There is a nerve test that we sometimes order. Now, the nerve test, I've had it done on myself. It's a pins and needles test. It hurts, and I warn people about that. And the reason why is I don't like ordering tests on people if we don't need to. But depending on the circumstances, we need to figure out if it's the carpal tunnel nerve versus your funny bone nerve. Sometimes it can be pinched up in your neck, or the fourth condition called neuropathy, where the nerves are going a little crazy from whatever reason. And the last way to diagnose somebody is they come back and they're not sure if they have carpal tunnel or not. Maybe the nerve test didn't show it. Is I can inject a cortisone shot into the wrist. And I'm going to show that on the next picture here of how I do that. So if you look closely here, this is actually someone's wrist. This is the needle. So we actually stick the needle right into the palm right there, deep over the ligament, through the ligament, down where the nerve and tendons are. Now, if the cortisone shot helps, it proves to me you have carpal tunnel. If the shot doesn't help, maybe there's some other reason why your hand is numb. So if the numbness is relatively new and not too bad, we can just wear a Velcro wrist brace. We can just keep an eye on it. Maybe take some ibuprofen relief if you can take anti-inflammatory pills, if you don't have blood thinners, or if you're not on heart medications. So then we can also do the cortisone shots like we talked about. And lastly, surgery. Now, surgery, I tell people it's still surgery, but the surgery is not a very large surgery. And of all the surgeries that we do in orthopedic surgery in the entire United States, it's probably the most common surgery we do and the most successful. What the surgery consists of is this. I'm grab my pencil here and put a little mark on my hand. So the incision here is about an inch long, right in the palm right there. Through that incision, I cut underneath the skin. I cut from here to here underneath the skin. So the incision is an inch long, but I do a lot of work underneath the skin. Through that incision, that nerve is squeezed down in a tunnel along with the tendons. I go in there and cut open the tunnel to free up that nerve. We then close up the skin. I put a little brace on the hand for a couple of days. A good rule of thumb is, within 3 weeks, I'll let you do most things. Now, that can be a very sore spot in your hand, like pushing your hand out of a chair and getting up, but it's usually a very successful surgery. Usually, if you cannot sleep at nighttime, and I've seen a number of people just miserable, they have not slept through a night of sleep in weeks. The first night after surgery, they can sleep better because the nerve doesn't have the compression on it. So it's the most successful surgery that we do in orthopedics. Most people are back to work unrestricted within 3 weeks. So let's move on now to tendonitis of the hand, wrist, and elbow. Now, there's lots of different types of tendonitis here, and I'm going to touch on one called Derrick-Ovine's tendonitis in a little bit more detail in a few moments. I'm going to go down to the next 4. The first one is called flexor carporadialis tendonitis. What this is, there's a tendon that sits right here, right along this artery. So if you haven't noticed yet, there's a lot of things from arteries to tendons to nerves sitting all within an inch of each other. And you can also get ganglion cysts in this area as well. So it's a pretty common thing to have multiple things going on. So this flexor carporadialis tendon is usually a tendonitis, and usually you can see a small ganglion cyst in it where it's swollen as well. The next one is called intersection syndrome. If you look at the back of the hand here, if you look closely, I got some tendons that kind of stick out here. Well, this is where two tendons collide back on the back of the wrist. Third and fourth ones are elbow tendonitis. And you may not be a golfer, you may not be a tennis player, and you still may get tendonitis. The golfer's elbow is on the inside of the elbow, the tennis elbow is on the outside. And probably the most common thing that I see for people coming in with elbow tendonitis is when they've done something different, meaning that their elbow's fine, and then they go shovel 12 inches of wet snow, and a week or two later realize that they have a hard time moving their elbow because they hurt. And what that does is create inflammation. Or you maybe said, geez, I raked leaves for 3.5 hours on a Saturday. When you've done something a little bit different is where the tendonitis usually flares up. Usually that results for the golfers and tennis elbow, a combination of a cortisone shot, anti-inflammatory pills, some type of bracing, because the more you move your wrist here, more it irritates the elbow back here. So the wrist brace we usually use is a wrist brace to keep you from moving your wrist a lot. But obviously you can't wear a big wrist brace all day long if you are active. So we use something called a tennis strap that fits back in this area as well. So I'm going to move on to the most common tendonitis of the wrist, though, and it's got a fancy name called Derived tendonitis. So this is tendonitis that's primarily on the side of the wrist right in here. That side of the wrist here, there's a lot of things. We just said you can get ganglion cysts. There's an artery right there. You can get nerve problems. You can get ganglion cysts. But when people hurt on the side of the wrist here, it's pretty classic. And the special test is called Finkelstein's test. If you actually take your wrist, put your thumb inside, grip, and try to turn that way, that puts stress on that tendon. This is a little bit more common in women than men. Usually people kind of middle-aged because they're pretty active people. And you think about active people that are wearing out a little bit, it doesn't take a whole lot to turn a little bit of tendonitis into a lot of tendonitis. So moving on here. So the most common reason is overuse. Sometimes it can be related to a trauma, meaning that something hit or banged it. You know, you're splitting wood and a piece of wood bangs your back, your wrist here. It's usually more repetitive. People do a lot of crocheting, if they do a lot of knitting, small things. And some people just poor technique. They're gripping and squeezing, and they're hurting the wrist just the way they're doing that. So treatment-wise, if you look closely at this woman's hand and wrist right there, you can see a little lump or bump right there. So sometimes people get tendonitis in that area, and you actually can see it because it's swollen. So if that's the case, is usually a cortisone shot into that part of the wrist will help immensely. So activity modifications. If you said, every time I rake leaves, this happens, guess what? You should probably pay someone to do your leaf raking. Obviously, it's always inconvenient to do something like that, but if you know it's going to flare up, you're going to be miserable for a couple of days or weeks, try not to do it. Maybe try to do anti-inflammatory pills. So if you can do if you don't have any blood thinners, if you don't have any reasons not to have anti-inflammatory pills, you can do ibuprofen, which is 4 pills 3 times a day. So 12 pills max of ibuprofen. If you're going to do something like that, take it with food so it doesn't bother your stomach. If you say, I'm going to go shovel my snow, maybe taking 2 Aleve twice a day with food as well. That can bring inflammation down. Now, the splints for the thumb are a little different. So before we talked about a splint to keep you from moving your wrist back and forth. The splints for the thumb take your thumb out of action. There's hard braces and soft braces. So I try to get people in soft braces. When you think about your hand, you want to be able to open and close your hand. Because if your thumb is in a hard brace, you can only move your fingers, you're pretty useless. So a combination of an injection, a splint, therapy as well, and hand therapy is very specific. Physical therapy involves all the major joints, including your neck and back and shoulders and knees and hips. Hand therapy is usually hand, wrist, and elbow. And there's cortisone shots. And the last thing we reserve is there's always a surgery to fix a problem, be it tennis elbow, golfer's elbow, Derived tendonitis. Most people get better with non-surgical means, however. Arthritis, and we already mentioned there's 3 types of arthritis. The most common is the middle one, osteoarthritis. That is just the wear and tear of getting old. There's post-traumatic arthritis, meaning that you fell, you broke your thumb 25 years ago, you caused some damage. Now you get arthritis because it didn't heal perfectly. And the third type, we're seeing this less and less because people with inflammatory arthritis or rheumatoid arthritis, that is where your body's attacking itself. We've found out that there's lots of different medications out there that are much better now to treat these medical problems. By using these medications, be it pills or shots, they help bring your inflammation down, but there's obviously risk factors for any type of anti-inflammatory medications. If you look closely on the picture on the right-hand side right there, this is somebody's thumb right there. And it's trying to indicate the most common area of arthritis is the back of the thumb. When people say they hurt for the thumb arthritis, they usually hurt like right in the palm, especially a lot of gripping and squeezing. For example, if you had to get a wire cutters out and grip and squeeze and cut a piece of wire 100 times, that involves your thumb quite a bit, and that's where that starts hurting. So different symptoms. I sometimes can just look at somebody and tell they have thumb arthritis because on the back of the hand, right in this here area, I can see it's swollen. And that swelling is because it's arthritic and inflammation is created. Same as if somebody has an arthritic knee. Sometimes I can just put them in a pair of shorts and see what a normal knee looks like. And then I can see what their swollen knee looks like. And I can say, I bet you're here for the swollen knee. And they'll say, yep. So pain, achiness, stiffness, lack of motion. And you're going to notice that as we get older, to get your fingers turned right and do this here, it's going to get harder and harder. It's very common to have arthritis at the tips of the fingers and these joints. Usually the thumb is the most common though, and that's the one that people complain about because that's the one that hurts the most typically. So in terms of diagnosis here is sometimes we just look at the hands. If you look at the person, x-rays on the bottom here, I can just look at this person's hand and look at the index finger here, and I can see how the index finger is curled in, and that's horribly arthritic right here. I can see the back of the thumb here, and the back of the thumb there, it's swollen. They have arthritis there. Their little finger doesn't straighten out all the way here or there, and I can tell you there's arthritis in these joints. So sometimes just looking at it, I can just look at it and tell that there's arthritis. Now, the big thing for people is if they can't grip and squeeze, they lack strength. Especially if you can't close your hand all the way, how do you grip onto something? So something as simple as a golf club. If you can't squeeze tight, sometimes we say, well, instead of trying to get your fingers more motion, which is not going to happen because of the arthritis, is put a bigger grip on the golf club. That way it can be held easier. So we're looking for strength, deformity, skin abnormalities. If you looked at your hands and compared them to your mother's or grandmother's hands, sometimes things run in families. And obviously an x-ray will indicate if there's arthritis in the finger. So how do we get people better? Well, if you look closely at this person, I mentioned how there's a brace for someone's thumb, and that brace includes the thumb right through here. This is more of a hard brace, so they have a hard time moving their thumb, but they do make soft braces that still let you bend your thumb up and down, and you still get some power. So the big thing is, if it hurts, try not to do it. If the mulch truck comes and you have to mulch all your beds with a rake and if you feel like it's going to hurt, recruit the grandkids to help with a project like that. We can do therapy sometimes and work on getting your strength back. Anti-inflammatory pills, and they make a good gel now called Voltaren gel that gets absorbed through the skin. That seems to help. We can do splints, again, for the thumb, hard braces, soft braces. And the thing that I think helps people a lot is doing a cortisone shot right into the base of the thumb where the swollen. And that usually lasts anywhere from 6 to 12 weeks. So if those shots help, be more than happy to continue doing shots indefinitely, as long as there's no skin irritation. And the last thing we can do is surgery. In terms of thumb arthritis surgery, it involves going into the back of the hand here and removing a bone. And then most people use a tendon we steal to fill in the gap where the bone gets removed. Unfortunately, that's a very lengthy recovery. And if you ever had a hip or knee replacement, then it's a 3-month recovery, very similar to this hand surgery as well. So now we're going to move on to probably the most common thing I see in the office here. Of all the hand abnormalities I see, someone will come in and said, oh, I'm trying to move my hand like this here, and my thumb gets stuck. And I got to pry it open. Or my finger gets stuck down and I got to pry it open. Or maybe it's not locking yet. Maybe it's clicking or catching. So it's called a trigger finger. The fancy name for this is stenosing tenosynovitis. That's why I think trigger finger is a much better name for this. It involves women a little bit more than men. As we get a little bit older, there's more inflammation around those tendons. The thumb and the ring finger are the two most common. And it's not uncommon to actually have more than one finger involved, or one hand, one finger, the other hand's another finger. And that may be the middle finger in both hands, maybe a thumb on one hand and the index finger in the other. A little bit more common if you're dominant, like your right hand be your right hand. Probably the biggest thing I see though is if you are a diabetic, and if you're a diabetic who's not being treated well, there is a higher risk of inflammation around those tendons, hence a higher risk of trigger fingering. So if you look at this here finger, you can see the red area underneath the skin right there. Well, someone colored that in. That's not real. But this is showing how someone's finger is kind of stuck into the palm, and you'd have to almost yank it open. And that's uncomfortable for most people to do so. So when somebody comes in here, this is showing a picture of someone's thumb. It's kind of stuck down like this here, meaning that it's bent in like this here. And so the thumb is supposed to get all the way straight. A lot of times we can feel it catching or popping as it move the thumb up and down. So usually it gets stuck all the way straight, but on a rare occasion, it also gets stuck with it all the way up. Usually it's stuck with it bent down, but on a rare occasion, someone says, I just don't want to move it at all. It's all the way straight. And the reason why is it doesn't want to move through that area. Sometimes you can feel a little lump or bump, and the lump or bump may be a nodule that's in the tendon, or it's actually some fluid, which is a small ganglion cyst. So if you can imagine if you were fishing with your fishing pole and you throw your line way out there and it gets full of seaweed or grass, and you're pulling it in, your line is trying to go through that little hole. Now if it's getting stuck, or maybe it's all gnarled up, it doesn't want to get through that little hole anymore. That's kind of how trigger fingers work. So treatment options again. And the picture on the right shows someone getting their hand stuck with a needle into the palm. This shot is very helpful. Unfortunately, it's the most common areas of pain receptors. So doing the shot in the palm is not very fun, but it is very effective. If people get the shot, 2 out of 3 people, the shot will either help immensely or cure. So I usually try to recommend doing these shots before we consider a surgery. You can try anti-inflammatory pills. You can try some therapy. I find the shot is the most common thing that's going to help people. And if you tried the shots, or somebody who's had shots before, there's a handful of people out there that cortisone shots don't help much, there is a surgery. Now that surgery is not a big surgery, but it's still a surgery. And there's lots of different ways to do it. But ultimately, we're going to go in there where the tendon is getting stuck like this here, go in there and cut up the little pulley. That way the tendons can slide once again. That surgery is about a 2 to 3 week recovery. And the last thing we're going to talk about here, I believe, is cubital tunnel syndrome. Now, cubital tunnel is the opposite of carpal tunnel. And if you've been following my talk, we talked about how carpal tunnel involves your thumb, index finger, middle finger, and maybe part of your ring finger. Cubital tunnel is the nerve being trapped way back at the elbow. It's on the inside of the elbow. It involves numbness to the little finger and maybe part of the ring finger. It's not there all the time. And sometimes you can get a lot of pain on the inside portion as well. I found, since I had the same problem myself that ultimately needed a surgery, would be if I'm sitting at my desk and kind of have my hand bent out like this here, or laying in bed with my arms bent like this here, that pinches that nerve off. So I learned how to sleep with my arms straight for a while before I ultimately had surgery. And if you wait too long, the nerve is severely compressed. Sometimes you can see that the muscle shrinks down in the back of the hand. I see about 1 person a month that they have waited too long to have that surgery. So So this is a picture of the fingers that are typically going numb. And if it goes too bad, sometimes you have so much muscle wasting that your little finger gets pulled off to the side here as well. Sometimes we get x-rays of the elbow to see if there's arthritis in the elbow or a bone spur pushing on that nerve. And that could be something that's going to delay a prognosis as well. Sorry here. So how do we diagnose this? It's listening to the patient, them telling me which fingers are going numb. Sometimes we touch that nerve on the inside portion of the elbow. It's called a Tunnel's test. We get x-rays to look for arthritis. And then we sometimes do nerve tests. And it's pretty common to do a nerve test, but the nerve test doesn't always show it. And the reason why it doesn't always show it is because the nerve test is only showing one picture in time. And it may be compressed more at nighttime or maybe compressed exercising or something like that. So different treatment options. Number one, if you're bending your elbow like this here and sleeping in bed like this here, maybe trying to sleep with your arms straighter. We actually make braces for people that keeps their Velcro, a Velcro brace to keep their arms straight at nighttime. Obviously understanding what's causing it. And if you realize that you can change how you position your arm, be it at sleeping or daytime, it may help. You can try some anti-inflammatory pills. That's called a non-steroidal anti-inflammatory drug. That is this here fancy term right there. We can try a little therapy as well if it's a mild case and see if it goes better. This is the splint that we're wearing at nighttime that gets Velcroed on. And ultimately, there's a surgery to fix any problem. And the surgery usually involves moving the nerve around. Either we just release it on the bottom picture right here, the little yellow is the nerve. We release the nerve from behind it, and we move it to the front, or we just release it and leave it backward where it wants to be. So that recovery is about 3 to 4 weeks if we did surgery. And that's not a big surgery, but I consider that more of a medium size surgery. So in conclusion here, that was my talk on hand, wrist, and elbow problems. And I'm going to open the floor to Chris to see if there's any questions I can answer.
Thank you very much, Dr. Metz. I really appreciate the information that you give. We did have one question come through. And again, as a reminder to anybody that on the call still, if you have further questions as we move forward, please put them in the chat, and I will certainly get those to Dr. Metz. So Dr. Metz, we did have a question from Tim regarding arthritis that you mentioned. He asked, is cracking your knuckles bad for you, and will it eventually lead to arthritis?
That's a $1 million question that I wish I had that my first day of medical school to answer that question. And I don't think personally it's bad for you. Cracking your knuckles doesn't always cause arthritis. So I don't know anything that shows it any better or worse, but sometimes I just kind of feel like you just got to loosen them up a little bit, and the cracking seems to work. I'd encourage you to do whatever you feel most comfortable.
Thank you for that. Another question I had regarding some of the nerves that are within the hand and wrist. You talk about the median nerve and how that is fixed. Is there anything that, I know you touched a little bit about it, and I know this is primarily for therapy, but what about home exercise, things that a patient can do to kind of do some of these things on their own to alleviate some of the problems that they may be having?
Well, there's always an alternative treatment for everything. And the big thing, if someone comes in and says, hey, my fingers are numb, that's tough for therapy to solve that. But if they say, well, there's some numbness and that's not horrible, but I have a lot of weakness. And that's where we need to try to work and get some strength back. And are you weak because you have thumb arthritis as well? Sometimes people are weak because they don't want to move their ring finger because it's catching as well. So I would say every other patient I see with a hand problem has at least 2 problems, meaning that they have carpal tunnel and thumb arthritis, or they have thumb arthritis and a trigger finger. So usually it's not just treating one problem, it's treating the 2 or 3. And that's where sometimes, maybe somebody that we do therapy to get their strength back, I do a cortisone shot for their trigger finger, and then I send them off for a nerve test to find out how bad their carpal tunnel is. So a lot of things run hand in hand, and especially in diabetics. And I can't stress, getting your sugars under control is one of the best things you can do to try to help eliminate and prevent hand abnormalities.
Yeah, that's some great information. I'm glad you were able to bring that up. To finish up, we do want to encourage everyone again. If you have other questions, actually, we did have one just pop in here. Dr. Metz, for patients that have an underlying condition like rheumatoid arthritis, do the treatments or surgery have a long-term impact, or will rheumatoid arthritis eventually cause further issues down the line?
That's a very broad question because it depends on how your rheumatoid arthritis is presenting. Is it presenting because you have swelling in the whole hand? Is it because you just have a trigger finger? Is it because it's putting pressure on the nerve and you have carpal tunnel? I mean, years ago, and I say years ago, I trained from 1997 to 2002. So it's almost 25 years ago. And the medications weren't very good. If somebody had rheumatoid arthritis, they put you on prednisone. And what happened is you face really swelled up. It would affect your kidneys and adrenal glands. It would bring inflammation down, but never really control the disease really well. So when the people with rheumatoid arthritis now, the medications are so much better to modify the disease, meaning that if your hand is swollen up because of rheumatoid disease, it really brings the swelling down to be able to get the function back. Unfortunately, these medications knock your immune system down. And so people have higher risk for catching other diseases because of that. And especially in the world of COVID right now, people are very cautious about adding medications to that if they have to. So going back to the question specifically, rheumatoid disease has so many different presentations. It's in a joint, it's in a tendon. It depends on where the person's disease is at will affect how I treat it.
Excellent. Thank you very much for that. And as you are looking at the screen, folks, you can see Dr. Metz practices out of our Schwabenau Health Center, which is attached to the Western Racket Club. If you are interested in calling to make an appointment with Dr. Metz, we certainly encourage you to do so. You can call the number that is listed on the screen there. And that wraps up our presentation for this evening. We thank you so much again for attending. We hope that you did find it helpful and valuable.